I'm Luke Fortney. I'm a physician with the University of Wisconsin Department of Family Medicine and also in the Integrative Medicine program. And I'm here in the summer of 2011 talking with Rob Edwards, my colleague and friend, about particularly autism and children with autism and families that are touched by autism.
Great. Well, it's good to be here.
Yeah.
Thanks for having me. So, I thought first off, thank you for the opportunity to come and talk with you. And, as you know, this is an issue really near and dear to my heart. My youngest daughter has been diagnosed with one of the autism spectrum disorders, PDD-NOS. So that was really the motivation for me to learn as much as I could about this group of diseases.
And can you say what that means, the abbreviation?
Pervasive developmental disorder not otherwise specified. And, if you think of autism as a spectrum of disorders, you have classic autism, which we consider the most severe. PDD-NOS is sort of middle in severity, and then Asperger's would be considered the least severe in regards to, the measures we usually use.
I've also heard it described as high functioning, or the highest form of functioning for autism spectrum disorders.
Asperger's, yeah, that's the term they used to use is high functioning autism. So yeah, so Allie's kind of right there in the middle, and whatever that means. But that was really the motivation for me to learn more. And given we're both very integrative minded, I really wanted to explore what more could be done for children with autism beyond sort of the conventional stuff that's done, which is quite honestly pretty little. Yeah.
Well, with your background in having your daughter diagnosed with autism, how old was she when that happened?
Her diagnosis came right before her 3rd birthday. It took a while to get in to see a specialist who is qualified to make that diagnosis. It was about a 4 to 6 month waiting list. Or wait to get in to see the specialist. So that was, that's kind of agonizing when you suspect that there's something seriously wrong with development and you're waiting to hear the news. Always in the back of your mind kind of hoping that, everything is fine and it's just sort of a normal variant of development.
Because I know many parents have anxiety as a workup is in progress. Mm-hmm. And you've been on both sides of that situation, being a physician and then a father with concerns and health concerns for your daughter. Can you speak to both those perspectives and what that was like right around that transition time?
Well, as a parent and a family, devastating, really. I mean, that's, your children, you always hold out the highest aspirations for them and the biggest dreams, and, you kind of, or at least I did, I could envision 20 years in the future and all these amazing things that were going to happen. And so, once you see your child not meeting the normal milestones and there start to crop up a lot of questions about development, that's agonizing and very stressful, very, it creates a lot of anxiety. And, it's a great place if you have the resources to insert more mindfulness, because your mind really gets away from you. And the more I agonized over what would happen, what's going to happen, the worse, I was.
So this is what you're speaking about, is you as the parent and treatment, integrative approaches, in this case, mindfulness meditation or mindfulness awareness, you're using it for yourself.
Absolutely.
Through this process.
Yeah, and during that period of time, this was kind of before I really started to expand my understanding behind these techniques. So I didn't really use it, but looking back, it would have been so valuable.
By these techniques, you mean relaxation techniques, stress reduction techniques, mindfulness awareness, breathing, things like that?
Exactly. And looking back, I mean, this is kind of what I'm hoping to provide moving forward, is a place for families to come and get that awareness, or have somebody sort of bring that awareness to the families. Because at that point, I'm really not thinking about myself at all. And so if somebody along the way would have said, this is going to be extremely long and difficult journey. These are some tools that may help you and your family get through it. Let's spend some time exploring it. That would have been amazing. And, you know, I think a lot of families who have children with autism or frankly any disability go through a lot of time feeling very isolated and, you know, without as much support. And I think autism that's especially true because for so long it was really considered so much of a behavioral entity as opposed to like a whole body condition. And so it really, you know, it wasn't, you're not as supported by the community as if you have a ill child, even though your child is very ill.
Yeah, and you kind of hint at there's been a lot of progress in how autism is treated and received and even how it's seen. And you also alluded to, you said, I wish I knew of many of these things while I was going through this. And we already mentioned mindfulness awareness, mindfulness meditation. Are there other things that you found helpful through that period?
Well, I think you know, really taking care of myself, trying to get proper sleep, you know, not lose sight of importance of diet.
And the sleep is
exercise.
Really difficult because you're a physician and you have kids.
Yeah, right. Yeah. So, you know, all of these things really went to the wayside. And I think having somebody support, you know, or sort of nudging you back towards looking at the big picture and saying, hey, you know, you got to take care of yourself. This is going to be a long process. You know, the more you can take care of yourself now, the better everybody is going to be.
As best you can, right?
As best you can.
Because when we work with families, and many times we see them in clinic, and there's a lot of stress and sleep deprivation. And one of the things I do in my clinic is as best I can, I try to encourage people to aim for these healthy behaviors, for self-care, wellness. And I always add the caveat of as best you can, because sometimes things are just really difficult.
Yeah, yeah. So, and then the second half of your question was, as a provider, you know, sort of that early phase of early diagnosis, what is that like? I think, you know, as my knowledge base has increased around this topic, I kind of understand and I see my place more clearly. But early on, it's really very confusing, and certainly didn't get any training regarding this in medical school or in residency. So, you know, I think earlier on, I really didn't know my place. Now, the way I'm looking at it, I would say a family physician has a great or potentially a great role in providing care for the whole family, and really sort of starting conversations with moms and dads around, you know, maintaining wellness and, you know, maintaining perspective and staying hopeful, because a lot of times you lose hope, and honestly trying to guide them through the process. You know, the process initially was just so overwhelming, and, you know, I consider myself and our family as pretty high functioning, and just to navigate through the system was overwhelming.
And being in the system, even with that, it was overwhelming.
Even within being within the system, it was overwhelming. And so you know, there's a lot of work being done, and Madison is a great example of this. There's a great center of excellence, the Weissman Center, and even with that resource, it's not that easy to tap into all the resources available to family and children with disabilities, and they're really working on that and trying to provide outreach and trying to help educate doctors on ways of connecting the dots. But it's still not a straight path, and it's still pretty difficult.
Yeah, navigating a sometimes difficult to follow path.
Yeah, and a changing path. Like the resources here this year, but maybe not next year. And, you know, with certainly with budget cuts and, you know, financial issues and crisis, I mean, it's
emerging new evidence and changing insurance policies, changing jobs. Can you speak to some of, so for families and parents with children with autism, what are some of the fundamental or large areas that they have concerns about or struggle with or work around?
You know, as far as being as far as taking care of their child, I would say honestly, the developmental stuff is really important, but very common issues that you'll see crop up over and over again are sleep disruption, problems with sleep, problems with digestion, and normal gastrointestinal functioning, and then allergies. And that can manifest as allergic rhinitis, chronic ear infections, excuse me, asthma, chronic skin conditions. Those seem to be very common. And so really finding a physician who understands that and, looks at your child as a whole and saying, okay, your child may be diagnosed with autism, but there's all these other things that we should be addressing and treating pretty aggressively. Because one thing that really is becoming clear is a lot of behaviors that we've classically attributed to autism disorder could really be manifestations of physical disease that's going on, pain, this sort of thing. So looking beyond just the diagnosis.
A common symptom with an unusual presentation for children with autism.
Exactly. If there's one thing I would really encourage parents and providers to do is looking at some of these behaviors as maybe clues into other things going on. I think the prevalence of GI disease, and things like gastroesophageal reflux disease, esophagitis, chronic inflammatory bowel disease of different sorts, it's really, there's a lot of that in this population, and many times it will manifest only as behavioral. And many of these children really are struggling to communicate on so many levels. The only thing they may be giving us is a behavior or sleep disruption. So we really have to be very attuned and very open and conscious of that.
So when the treatment actually starts, the treatment process for kids with autism, and you're meeting with a family as a physician for the first time, and you see many different types of families with different backgrounds, and they have different questions and different interests and different beliefs. I'm curious to know where you start and how you start that process. Anything from different forms of alternative medicine to resources like respite care and things of that nature.
Well, this is something I'm still really struggling with, to be very honest. It's a work in progress. I don't have a set protocol. And that would be nice. I think that's something I'm sort of aiming for and working towards. Right now, the way it feels is I'm kind of meeting families where they are and trying to be as supportive as I can. But I'm working within the system as well. And it's not set up for a lot of the work that I would like to offer, specifically time-based visits. And most of us, or a lot of us within the system, work on anywhere from 10-minute templates or time slots to 15 to 20 minutes.
Shorter time slots that don't allow us to really do the work that we'd like to be doing with the families.
And you always adapt to the needs at that moment, but within reason, because there's also pressure to stay on time, to other patients have schedules they have to keep and are taking off work. So all of these things come into play. And so really what I'm trying to develop and think about is developing this concept behind a medical home for children with disabilities and their families. And it's more of really anticipating needs that are probably going to be there ahead of time, and saying, okay, this is a family that they're going to have special needs. We're going to ahead of time plan appropriately, and a lot of that includes longer time slots. And from that come up other questions. Are you going to be able? How many children will you in a single practice be able to support in that way? Because we have systems that don't really recognize the importance of time-based care. It's
healthcare systems.
Healthcare systems and HMOs, et cetera. So those are bigger issues. But I think for me as a provider, that's really what I'm moving towards, is anticipating that we're going to need more time, so that maybe I can talk about some mindfulness-based stress reduction techniques, talk about diet, talk about self-care, and include that in a whole visit.
In a real dynamic way, because every, like you said, every patient, every family is different, and you're trying to meet each one where they're at and have an actual dialogue, and that takes time.
Yeah, and so that's the ideal. But I have to be very honest, I'm not there yet. The way, you know, I'm seeing children now is still very much a problem-based visit, and you know, kind of trying to address the issues at hand. And there are usually quite a few of them, and some very serious. So, you know, we're trying to work through those issues, and you know, it doesn't always feel good, because I feel like I'm holding back. I'm not addressing things that I'm seeing that maybe have not been brought up. But you know, I'm learning, and I think I'm learning to start conversations early on. When we're starting to wonder about development, we're starting to wonder about if this child may be at risk. I'm starting these conversations much earlier.
And you just speak to one of the most powerful resources, and that's having a therapeutic relationship with a provider, a physician, a PA, an NP, someone who knows you over time and your family and can be there as an advocate.
Right.
And who has experience and can look down the road a little bit and anticipate what challenges might be arising to help that family navigate through this difficult path.
Exactly, exactly. And I'd encourage families to, you know, number one, educate themselves as much as possible. That's the most powerful tool you're ever going to have. You know, knowledge is absolutely power. And there's a lot of information out there.
Are there some good sites or resources?
Well, I think, you know, the one we're putting together here at the University of Wisconsin, the Integrative Medicine webpage, and then this module in particular, is a really good site. And the hope is within that site we'll be linking a lot of the other techniques, because, you know, there's information readily available. So I think that's a really good place to start. One of our colleagues, Shar Lichterhan, did a lot of work in the patient side handout to list resources that are available for patients and families. And so she did just an amazing job at bringing that information together in one place. So I think this is a really good place to start. And then I think, you know, as a family and a patient, educate yourself on the system you're working through. So ask, you know, how much time is this visit for? You know, how much time am I allotted? And if it doesn't seem reasonable, ask for more time. I mean, you can do very proactive things as well to help and enhance that therapeutic relationship with your provider. So, you know, I think educating ourselves as providers and doing more on our side, but it has to go both ways. And patients really have to start taking some initiative in regards to that, and just understanding the system and knowing what you're getting into. I think knowing exactly how much time is scheduled is a really important one.
It's in a way, it's having really clear expectations about what this short visit or maybe a longer visit can do, and being as clear as you can with the top concerns as a family that you have going into that visit.
Yeah. And
then maybe even frequent follow-ups or regular follow-up.
I think that's vital. And, you know, you can't expect to solve a problem this deep, this multifaceted in one visit. It's just not going to happen. And so building a long-term relationship, I think, may be one of the most powerful things in all of this.
And a team-based approach, too, relying on other people such as physical therapists, occupational therapists, maybe yoga instructors, people in the community, social workers, as well as alternative medicine forms and modalities. Can you speak a little bit about some of
I'll give
those
one
things?
Yeah, I think that's excellent. That's a really good way to look at it. I'll give one example. My daughter had chronic ear infections, and to the point where, you know, she had multiple rounds of antibiotics, and the same story that you hear over and over, that they started to be less and less effective. We moved on to stronger ones. You know, we start to see some of the side effects from overuse of antibiotic. So we're getting to the place where, you know, we might have to think about ear tubes. And so just through my work, I understood a resource that was available could potentially free some of that congestion in the middle ear, just understanding the pathophysiology behind chronic ear infections. So I sought out a craniosacral therapist in the area, and Allison started to work with her.
And craniosacral therapy, if you want to say what that works with in particular.
Well, do you have a good definition?
Yeah, well, we can. So basically, for
why don't you explain it?
Those who are listening in, it's falls into a category of alternative medicines called body work or manual therapies, and it's a form of gentle pressure points on different sutures of the head and neck, and it can be really, really valuable when you find someone who is knowledgeable in these areas.
Yeah, and we did. I felt like we did. Somebody who was very comfortable with children, and it was an interesting process, I'll tell you. It kind of, you know, as a provider, I'm realizing I have to experience a lot of these modalities myself. You know, you can read about them, you can study them, but you have to experience them to really get that deeper understanding and appreciation. So this was a really good experience on a lot of different levels. But she went for several treatments. I think the total was 3 or 4. And, you know, I had a little bit of advantage because I could take her home and look in her ears, you know, and monitor day by day if there's some progress. And sure enough, it was phenomenal. It really worked. And
how long was each session?
Each session was 15 to 30 minutes. It's about 30 minutes.
So middle to short sessions, 3 to 4, and that was something that was not invasive and a resource in your community that you and your daughter found helpful.
Right, and you know, this was before Allie was verbal, so we had to kind of read her, you know, response to it, but she eagerly went back each time, even though the sessions kind of created a outflow of energy. And sometimes manifested as tears, but there wasn't pain. It was just, it was pretty fascinating. So, you know, we got past that point, and she's had very few ear infections since, and we didn't have to go to ear tubes, which is not an awful thing. I think, you know, that's certainly better than having to do round after round of antibiotics. I mean, either way, you know, there was going to be some help.
There are a lot of options, and many of these options meet people with the different forms of, say, chronic ear infections.
Right. But that was my experience with a alternative or complementary therapy that really worked. And so that's one that I'll recommend sooner than later.
Are there others that you've experienced that have been helpful that you would recommend?
For me personally, or for my child?
Well, for both, even for like you mentioned, mindfulness as a parent, helpful to you to be present and to be there with the stress and the challenges, and then also other modalities that work for the kids.
I would say, speaking from my own experience, you know, the more presence-based I can be, the easier it is to sort of navigate through life and its challenges. And there was a period of time where there's so much uncertainty with what was going on that I found myself 100% either, you know, future living or past living. And I realize now that that was a very miserable existence. You know, I found very little joy in life and sort of day-to-day experience. And so much of my time and energy was spent worrying about what could be or what would be, and it turns out none of the things I worried about really have come to fruition, and a lot of different things have happened since then. So
there was a lot of storylines in your mind about predictions of the future, and you found yourself stuck in those. Having an effect on your well-being, your stress levels, maybe even in your body, and mindfulness was helpful in anchoring you back into the present moment. Yeah,
and it's, you know, my practice will wax and wane. It's kind of the best you can do at that moment.
That's right.
You know, but I think going through that practice and increasing my awareness and understanding myself was really the biggest part of that. So for me, that's probably been the most positive and most powerful, you know, sort of complementary thing that I've experienced. For Allison, you know, we've tried quite a few different things. I would say certain supplements have been helpful. You know, really addressing dietary concerns has been important. You know, none of these things I found to be perfect or solve everything, but have been helpful in their own way. And so really, you know, I think the message that I have taken from this is that it really is a big picture view, you know, a holistic
unique
view.
to each person and each family and each situation.
Absolutely. You know, when there's you know, a saying that will come up all the time in when you're working with autistic children, and it's when you've seen one autistic children, you've seen one autistic child, because each one is very unique. And you just have to address the uniqueness as that.
It's good for both the provider and the parents to keep that in mind, that every child, or adult patient for that matter, that presents to our clinic is unique. And it's our job to get to know them and find out what's important to them.
Yeah. And that takes some time. Right. I think that's the beauty of integrative medicine, really, and why many people are finding themselves attracted to that form of practice. And as a provider, it's much more satisfying as well.
Yeah.
And so I'm excited about things happening.
Yeah, you know, one of the questions I get a lot is, speaking of diet, the gluten-free, casein-free diet. And I'm curious to know what your experience of that has been, and from a parent perspective and a physician perspective.
Yeah. Well, if you look at the clinician handout, I would say this is probably one of the most evidence-supported non-conventional therapy, if you were, that's out there. I think there really is good evidence to show that a subset of children with this condition will respond favorably to a gluten-free, casein-free diet. I think there's still questions out there about, you know, what exactly is going on and how is it effective, and you know, what you should do long term. But I think it's a really viable tool, and it would make sense to me to look at that earlier than later. You know, when you're looking at this whole paradigm of, you know, risk-benefit of everything, you know, you have a potential therapy with a wide therapeutic window. I mean, the risk is very small, the potential benefit is very high. That's really what we should be targeting first.
And something like diet changes are safe, relatively straightforward to do with some variation depending on where you live. And it's also something that can have a big or a significant benefit for some patients.
For some patients. Yeah. And the more recent data I looked at kind of brought to my awareness that, you know, my previous recommendation of doing a 2 to 3 month trial may not really be adequate. Really, I think, you know, now my recommendation would be more of really a commitment for at least 6 months, if not a year, because there were some subgroups that responded later in the dietary change, you know, looking at 8 to 12 months out. They were still seeing some changes or improvements. So that was kind of new for me, and that's changed my recommendations regarding the gluten-free, casein-free diet. There are a lot of issues, though. I think, you know, the social impact is real. You know, when you change a diet so dramatically from what we consider the standard American diet.
The abbreviation of that is SAD.
Yeah, for reason. You know, that's tough. That affects everybody. That affects the whole family. That affects the child's ability, you know, who already may be struggling with social isolation. It may,
like birthday parties or bringing a cold lunch from home while at school.
Daycare, school is a big issue, you know, but it's getting easier. You know, there's a lot more recognition of the importance, and quite honestly, there's a lot more adults who are looking at that as a therapeutic modality and helping them feel better due to chronic fatigue or chronic GI problems. So there's movement there, and it's getting a little bit easier, but it's still, it's a challenge, and you have to prepare families for that and make sure people are buying into that. If you have one parent who is really, in favor of this and one who isn't, that's going to be more difficult. So maybe we should look for some common ground and create a conversation behind that and, really look at the pros and cons.
And the value of not pushing any particular therapeutic modality or treatment on a family or a patient that they're not really 100% behind. And that's really the importance of integrative medicine and continuity of care, is in the conversation and understanding what their needs and wants are.
Yeah, well said.
Yeah. Hey, I'm curious too, if you mentioned supplements. Are there supplements in general that you have found more helpful, and then supplements that in general that you have found not to be helpful for autism?
That's a big topic. No, I think really it's individualized. There's not one that I would say, that's got to be, at the core of every regimen. There's some that are very safe, very available and not too expensive that would make sense to use. One that comes to mind is like fish oils. There doesn't seem to be a good reason not to use that. So that may be one that,
aside from cost for some families.
Cost.
At which point there are other alternatives, ground up flaxseed or, other things like other forms of omega-3 fatty acids.
Right. Good point. But that would be one that I would think some sort of, anti-inflammatory omega-3 source would be, important for every child. Probiotics may be another one that, I might put in there. A good multivitamin, just to ensure proper nutrition and, making sure we're not missing any of the micronutrients.
And a multivitamin that doesn't have added colors or preservatives or things of that nature.
That's really a good point, and it really comes down to reading labels. And you'll be amazed. You read some of the labels on the supplements and, you have no idea what some of the preservatives are, and you will see a number of artificial colors and flavors for chewable vitamins. So, yeah, I think that's a really good point. And ones to avoid, I'm still ferreting that out. I'm still looking into that. And I think there's some that are used heavily that I'm not sure there's a lot of, or I know there's not a lot of good, solid clinical evidence yet to support their use. But, again, I think it comes down to looking at the risk-benefit for a lot of these things. And
risk-benefit cost comparisons.
Yeah. So I think those are all things to take into consideration. Yeah.
Are there other areas in this really wild and active and growing area that, in your experience, that you've learned through your wisdom as a parent in going through this process, and then in your learning as a physician that you want to share with folks?
Yes. Keep your friends, keep a good social network and, hang on to the people that really support you and prop you up and help you through those times. Invest your time into those people. I think that's just like so critical, and it's so easy to become isolated and feel like you're fighting this battle by yourself. And so you have to be willing to put yourself out there a little bit and communicate and, tell people what you're going through and
ask for help and
ask for help.
Have the right resources.
Yeah.
And time for oneself too.
Yeah, and it's scary to do that sometimes. And it's hard. It's hard for us sometimes to do that. So, yeah, that would be a big one. And I think, really trying to educate yourself as much as possible is another one. And looking for resources, because there are a lot of resources. We're not going to go through everything that's available, but there are a lot of resources. But it takes some looking. It takes some effort to sort of access them. We're trying to make it easier, but at this point it still takes some doing. So if you think there should be some sort of resource, there probably is, but it may just not be that obvious. you might have to look around and ask for some help.
Great.
Yeah.
Well, Rob, it's really been a pleasure chatting with you about this really important issue. And thanks so much for putting together and starting the process of collecting resources and information on autism that you can find on the Integrative Medicine website.
You're welcome. I'd also like to thank Amy Harvey, who is going into 4th year med school. She did a lot of the research, a lot of sifting through some of the research out there and trying to put together a really good comprehensive review of that research. So thank you very much, Amy, if you get a chance to watch this video. And Charlotte Derhan too. She's just been fabulous and really helped pull it all together and make it look good and, you know, make us look good, user-friendly. Yeah. So she's been just a gem as well.
Thanks a lot.
Thanks,
you.
Rob. You're welcome. Yeah. Thanks, Luke.